everyone, and thank you for joining us here for our parents information session virtually. We're thrilled to have you here on Zoom, I guess. I'd much rather be doing it in person, but for what it's worth, it's pouring rain here at Hill, so it might not be as enjoyable if you were in person. For those of you who haven't met me already, my name is Zack Lehman. I'm the head of school here, beginning my 10th year at Hill. And on behalf of the entire faculty and staff, let me just reiterate how thrilled we are to have all of you and your children coming to Hill this year as we kick off our 171st year at Hill. For some of our new students, let's see here. For some of our new students, the process of enrolling at Hill may have begun more than a decade ago when their father, no doubt a proud Hill School alumnus, dressed them in some Hill swag. For others of you, kids might have experienced the Hill School when visiting a brother or sister here for Parents' Weekend or something along those lines. And others still began considering Hill when they toured the school for the first time or came to a revisit day, perhaps contemplating boarding school for the first time. Due to the travel restrictions of COVID-19, an unusually large number of new students and parents enrolled at Hill sight unseen and are visiting campus for the very first time in the coming days, including the 8 students that arrived from Shanghai late last night for the first time. But today, all of these students will be joining us, and their journey at Hill will soon be officially starting if they haven't joined us already. And I assure you that your children are in for an exhilarating, rewarding, and meaningful voyage ahead. First days at Hill can be difficult for students and for parents. Lots of new people, buildings, courses, experiences, traditions, rules, and expectations. But in my years attending and working in boarding schools, I've found that students are usually asking themselves the same question on their first days at Hill, and that is, do I belong here? The answer to that question is yes, but maybe not in the way that you think it is. It's both in terms of the sense of this being the right place for them and the sense of them feeling like they belong here. Hill's an unbelievably compassionate and welcoming community, and there's a place and a group of friends for everybody. It may take some time for each new student to figure out how they want to fit into this community, and they may change their mind about that several times before graduating and jumping into the Dell like these students are doing here. But this will be their family away from home. On this first day, parents are all asking a different question. Will Hill take good care of my child? Every faculty and staff member that you connect with and everything that you learn about the school continuously prompts this question for you. It's a natural question, especially during a pandemic. Again, let me put your mind at ease. The answer is yes, Hill will take good care of your child, but perhaps not exactly in the way that you think we should. For the first few days or weeks, we're going to do everything we can to make sure that our new students feel comfortable. However, just as they start feeling comfortable, we're going to push them out of their comfort zone and into what I like to call the challenge zone, because we know that the best learning and developmental growth occurs when students stretch themselves. And there'll be lots of good people choreographing this dance between the comfort zone and the challenge zone, and of course, helping our students stay out of the danger zone. And parents can help their children by giving them some time and space to adjust to this new environment, encouraging your children to advocate for themselves and solve their own problems, and directing your questions and ideas to the appropriate adults in our community. While we certainly welcome you to visit campus, I hope that you all join us for Parents' Weekend starting on Friday, October 15th, to experience firsthand the gains your children have made and to meet their new friends and mentors at Hill. With all that in mind, I want to introduce you to some key people, the ones that you'll be seeing or speaking to on a regular basis. First of all, we have a fantastic faculty team here. We have 112 faculty members that will teach, coach, and advise your children, and I encourage you to get to know them very well. They're They're truly the lifeblood of the school. Next, I'd like to introduce our Associate Head of Schools, Sylvia Rodriguez Vargas, whose portfolio includes the entire student program, including academics, co-curricular activities, student and residential life, and wellness. Our Chief Strategy Officer, Linda Hamilton Kirk, whose team designs the entire student and parent experience, including our website, social media, on and off campus events, and school-wide communication. And many of you already know Tom Eccleston, our Assistant Head of School for Enrollment Management, who's responsible for our entire admission effort. You may have already met some of our other members of our team, but I'd like you to meet Ari Baum, who's on the call today. He's our Dean of Students. Mrs. Hudak, Katie Hudak, our Academic Dean, and John Jenikis, our Dean of Community Life. We also have what we call form advisors here at Hill, and they're people who are responsible for keeping each of our forms organized, unified, and happy. Megan Toomey and Matt Gettings are our third form advisors. Amanda Doherty and Dana Hunter are our fourth form advisors. Elena Dauphiné and Kevin Tkachuk, that's a tough one to pronounce, Tkachuk, are our fifth form advisors. The Eilbergs, Mr. and Mrs. Eilberg, are our sixth form advisors. Mrs. Eilberg also serves as our day student dean. Dave Page serves as our PG coordinator for our postgraduate students. Helen Cho serves as our international student and family support manager. And Shelley Baumgarten serves as our director of parent engagement. I'd also like to introduce some other key people who you'll likely connect to and come in contact to for a number of matters. You'll be hearing from the first two, Dr. Spencer and Lisa Rothling. Dr. Spencer is our medical director and Lisa Rothling is our director of counseling. I mentioned Mr. Eilberg before. He's our director of athletics and co-curricular programs. Ellen Dietrich, our director of college counseling. April Tischler, our new learning support coordinator. Reverend Christy Adams, our chaplain and dean of spiritual life and equity. Mr. Allen, who is our director of information and technology services. Anytime there's a technology problem, he's your person. Bo Kim, our director of studies and instruction. Dave Hoffman, who oversees student activities, and Marco Rothling, who's our registrar and oversees scheduling and transcripts and the like. Where the rubber really hits the road, however, for most of our parents and students is with some of our administrative staff, the people who answer the phones, handle logistics, manage day-to-day operations, pretty much keep track of everybody's whereabouts and waive permissions. And to that end, I'd like to introduce Vicki Fries and Darlene Bainbridge in the Dean's office. Ms. Fries and Ms. Bainbridge are the go-to people for campus leaves and waive information. Mr. Baum will be talking about that, I think, in a few minutes. Mrs. Winter in community life handles pretty much all residential and student life concerns and questions. Dawn Norman in the business office handles student billing and student debit accounts. Mr. Conrad, Bill Conrad, handles all transportation requests. And Ms. Curcio provides support in the academic office for all of your academic questions. And last but not least, I'd like to introduce you to a few key individuals that you should know. First of all, my wife, Amy Lehman, who's also a leadership coach here at Hill, working with our student prefects. Shonda Kramer, who's my executive assistant. If you need to reach me, she always knows where I am. Teresa Krell, who also supports the head of school's office. And of course, the most important member of the head of school's office, and the only one who actually agrees with me most of the time, my best friend and soon to be all of your children's best friends, my dog Ruben. Although the previous people I've mentioned typically have all the information and answers you'll seek in the coming months, sometimes when you just don't know where to start, you can always call me or call my office, and either Ms. Kramer or Ms. Krell can help you get to the right place. For what it's worth, our office also manages commencement invitations when we get to that point, and can direct you regarding guest house reservations, although for now the guest house is closed until further notice. Please note at this point forward, all student questions and concerns should be directed to the Dean's office, and that phone number is right here. If you need to reach someone outside of the normal school day, you can reach Hill Campus Security by dialing this number here, 327-3060. And security can actually connect you directly to the Dean on duty and off hours through an intercom system. So please remember that your child's advisor is a great contact for any issues, and Mr. Baum will be talking about that, I think. I encourage you to work together to establish a strong dialogue with your advisor. I'll pause a second here. This is a good time to take a screenshot, put these numbers into your phone. Again, Dean's office during the day, campus security, and the Dean on duty in after hours. For the rest of this session, today's journey, you're going to hear from Katie Hudak, who's our academic dean, Ari Baum, our dean of students. Then you'll hear from Lisa Rothling, our director of counseling, and then from Kristin Spencer, our medical director. Actually, I think Kristin Spencer will come first, and then Lisa Rothling, and then you'll come back to Dr. Spencer for a few last notes regarding athletic training. So that's where we are. I want to welcome everyone again, and as we like to say at Hill, welcome home. I'm very excited for you and all of your children. As we go through this today, please do feel free to enter your questions in the Q&A box or in the chat box, and we'll stop and take questions probably after each presenter, and then at the end we'll take more general questions. So I'm going to stop sharing my screen, and I'm going to turn it over to Katie, who I don't think is going to be sharing her screen.
Indeed, I'm not. Thank you very much. Let's see. Thank you, Zach. I do not have a PowerPoint for you this morning, so I'm grateful that Zach had pictures. That's what I actually was going to show, is a picture of each member of my team. So I'm really grateful that you were able to put a face to the names that you will see on your child's journey here at Hill, and indeed probably already have seen. As Zach said, my name is Katie Charles Hudak. I am the academic dean here at Hill, and along with my office, my main task, my main objective goal in life is to ensure academic success for your children here at Hill from the moment they step on campus until they have that storied jump in the Dell that we saw the picture of just a little bit earlier. So that task includes quite a number of moving parts here at Hill. And I do that with my great team of the academic office. It consists of, as Zach just mentioned, Jared Courtney, who is the dean of the Shirley Quadrivium. So he is my counterpart kind of on the STEM side. Bo Kim, my colleague here in the office, is the director of studies and instruction, and Marco Rothling, who is our registrar. And together we take care of all of the parts of the academic experience here at Hill. You've probably already gotten an email or two or three from some of those people, probably most likely Bo Kim, who works throughout the summer along with Marco, to get student and teacher schedules ready to go for the school year. And I'm pleased to announce that those student schedules will be released today. Teachers got them a couple of days ago, and we had a couple of final sort of balancing pieces to put together, and student schedules should be ready later on today. So you'll be able to see those. She also takes care of textbooks, which you've probably heard a little bit about. If you have questions about textbooks or your child's schedule, please feel free to reach out to any of us. Our other big task on campus is partnering with other offices to make sure that, again, the student academic experience is good. We partner with the dean's office quite frequently and the college counseling office, so that we can usher students through our curriculum, make sure they get those graduation requirements, and have a superior, rigorous, challenging, enjoyable experience here to move them on to the next level. So, that's a lot of words simply to say that your children are in good hands here academically at Hill. We have brand new to our office, April Tischler, who is a learning support coordinator. So if your student is struggling, as all students do at some point or another during their academic career here at Hill, she is a wonderful resource, whether or not your child has formal accommodations for, a either a formal diagnosis or is just having a rough patch or, struggling with a certain subject area or class, she can provide an added layer of support. And there are a lot of pieces to that added layer that you'll discover and your students will discover as the years unfold. So the sort of sum of my presentation is just that we are here for you. We're here for your children. Please reach out if you have any concerns about, curriculum, how your student is doing, homework, how to access extra help, a path forward. If your student is moving into the 5th or 6th form and wants to make sure that they're on track for what it is they want to do at the next level. If we can't answer your question, which we should be able to, we can certainly put you in touch with those who can. So that's
Mrs. Hudak, there is
yes.
a hand is up, so I'm going to let a question come.
Okay, great.
With, Alvin Lam. I'm going to let him talk, I think from Hong Kong.
Okay.
Alvin, are you there? Our first question of the day. Let's see if we can get it to work. Alvin. All right, well.
I see a hand up. He is muted. Do you know that you're muted, Alvin? If you're talking, your mic is muted.
Anyway.
Sorry.
There we go. Hi, Alvin. How are you?
By mistake. Sorry.
Oh, you have a question or no?
Sorry, I pressed a button by mistake. Sorry about that.
Oh, no. That's fine. That's
we're
fine.
We're looking forward to seeing Summer. Travel
Okay,
safe.
all right.
Okay.
Thanks.
Bye-bye. Okay. Anything else to share, Katie, or should we?
No, that was a good segue. I was just going to say, if there are any questions, I wasn't sure how you're going to handle that, if we were going to wait till the end or pause in between.
If there's any questions, I mean, I think I just want to reiterate what Katie said, that the academic office is very responsive. There's questions about scheduling, there's questions about course selection, questions about accommodations, and the like, and certainly throughout their time at Hill. Students can stop by the academic office on their own and make an appointment. And we really do encourage students to advocate for themselves and work through their advisors and come and directly in. So we do have now a hand up, which I hope is not a mistake. It's Maria Murray. So Maria, you have a question for Mrs. Hudak?
Yes, good morning.
Good morning.
Maria.
I just want to know if the student, for some reason, decide to change the class that he is right now scheduled. When is the last day that they can do it? Can they do it? Just that's the question. I know there's a lot of background behind that question, but just for the deadline.
Yes, there is a little bit of background, as you said.
Yeah.
Thank you for the question. I should have mentioned this earlier because it's always a question I get at this point, and the answer is absolutely. If your student is misplaced or, for some reason has changed his mind, he or she can meet with the academic advisor, his advisor, and we'll work with the student here in the office to make sure that happens if it's appropriate. And we try to get that done within about the first 2 weeks of school, because it does impact the student's academic experience pretty significantly. So we want to get that settled as soon as possible. But yes, it is entirely possible, and it happens all the time.
And I would just add to that, Mrs. Hudak, that because we're a relatively small school, changing one class can sometimes have a domino effect in terms of other classes and sections and schedule. So we try to work that out and avoid the conflicts, and we generally can do that. But some classes only have one section,
Yep.
and so it can be complicated in that regard.
Yeah, that's the issue. So we'll wait and see.
Okay. Yeah.
Thank you, Mrs. Murray. Kyle
you.
and Alex are both doing well. I saw them
Thank
yesterday.
you. They are loving it. So thank you.
All right. Bye-bye.
Bye.
All right. Well, why don't we move on? Thank you, Mrs. Hudak. If there's further questions for Mrs. Hudak, please post them in the Q&A and she can type away her answers, or we can come back to those at the end. So I'm going to now introduce Mr. Baum. Mr. Baum, you want to share your screen? There you go. We can see your notes. There we are. Perfect.
You can hear me okay? You can see the screen?
We can. Perfect.
Well, thank you, everybody. Hello, I'm Ari Baum. So I think for most of you, your parents out there, so you can just call me Ari, that's fine. Your kids will call me Mr. Baum. But as Zach said, we definitely, even in these times where it's more difficult to travel, and probably a lot, if not all of you won't necessarily be able to get here for the start of school, we certainly still want you to feel like you're right on this campus, even though the weather's not so good today, so maybe you don't want to be here at this exact moment, but it's been really nice weather up until today. The dean's office is sort of a central place that is a good place, kind of where all the different offices meet, especially as far as the day-to-day parts of the school. As Katie was mentioning, with some of the different programs that go on a daily basis, it can be confusing where it's coming from. A lot of the times the dean's office is just a good meeting point to make sure that students or parents kind of get where they need to get to, whether it be physically on campus or if you're trying to get a hold of the right person for whatever your question may be. We're also, and this is where it really impacts, I think, our parents, is that we're a clearinghouse for all permissions, including to leave campus. All boarding students leave campus periodically over the course of the year for different reasons. So I'll be talking about that in a moment, because all parents will play a role each time their child is desiring to leave campus for any reason at any time. We also track student whereabouts when your kids are on campus. So that's a really important responsibility that we have here, which is that anytime a student is marked absent from a class, we start looking for them right in that moment. We're definitely pretty strict about making sure that we know where all the students are and that they are where they're supposed to be. And where they are can be physically where they are, but also where they are in other ways. Zach was just mentioning it's a small school, and that really works to the advantage of our students, because our faculty are very dedicated to knowing where your kids are, not just physically, but also where they are, and are they in the right English class? Are they feeling good about their roommate situation? Are they feeling like they're growing and maturing in the ways that we all want them to be? So student whereabouts can look like a lot of different things, and that includes as far as just community culture, and basic disciplinary matters at the school, as well as campus security. So those are all areas that our office works on. A lot of talk about the term social distancing. We've all heard that term a lot in the last year and a half, give or take. And early on the pandemic, I remember Lisa Rothling saying in one of our meetings as we were sort of figuring out how we were going to do the pandemic at the Hill School. And we decided pretty quickly that we weren't going to use the term social distancing, even though it had been used so much out there. And this meeting is a perfect example of that, of us as a school just understanding that probably a lot of parents can't get here as easily as you could have a couple of years ago, and hopefully a couple of years from now. So I think that the dean's office in particular, we really try to ensure that there is no social distancing, even if there's a lot of physical distancing necessary, as is the case during the pandemic. We want to make sure that whatever barriers there may be between our students, that we break down those barriers as easily as we can. And that's, I think, what this presentation, my slides, are really about: how to stay close with your kids, even though you physically, of course, are not living at the Hill School. So some recommendations here, a lot have actually already been mentioned. The first and foremost, when I went to boarding school not super long ago, we just had one payphone in the dormitory for all 20 of the students there. So all the students in the dorm worked together to schedule times to make sure we weren't overlapping, because it was just the one phone. Of course, your kids go to school in an era where there's a lot more access for communication. I strongly recommend to you as parents that you set up in advance times where you will have phone conversations or Zoom conversations or even texting conversations with your kids. They will be difficult to reach during the day because they're heavily scheduled, especially early on in the year. So if you schedule, Sunday night at 7 p.m. Or something along those lines that works for all of you, you have a way better chance of being able to connect on a regular basis, because sometimes when you try to reach them, when might be convenient for your schedule, they may not be available. Zach mentioned, and it's really worth noting, you should all know who your student advisor is by this point. If you don't, then you can let me know. I'll put my email address in the chat and I can connect you with that person. But just about all of our faculty are advisors, and their job is to really look directly after your child and help you as the parent connect on anything. Again, whether it be a class conflict or a rooming challenge, whatever it may be, even though there's a lot of different people that Zach showed on the screen earlier on in the presentation, your advisor is almost always going to be the quickest at helping sort whatever your question may be. Logistical questions, you can always contact the dean's office. Zach put the number up, but I have a slide where I have the number later on in this presentation. Some other pieces of advice is to just understand our processes that are all outlined in the Hill School Handbook. It's good to reread and refamiliarize with that as much as you feel will be helpful. And I definitely recommend, and this is a big adjustment for a lot of families, to let your child take the lead. Even though you need to be very prepared and want to be prepared as a parent, at the school, we really partner with your kids first and foremost to work through whatever they're trying to work through. And we will partner with you, but more as navigators to help your child as different challenges arise. Now, a big part of that communication is just the logistics of getting to and from campus at any given point during the year. Students may request to depart campus for various reasons, which is different than we were able to allow last year during a point in the pandemic where travel was even more challenging. At this point, going into this year, we are preparing to let students leave when they request to do so. We're of course prepared to have them here basically all the time at this point. But on weekends that are open, which is most weekends, not the first two of the year, students are able to come and go. I'll talk about that more in a moment. Family commitments, college visits, and other types of reasons a student may leave. That is normal for our school for students to come and go. But there is a process related to that goes through a system called WAVE. The good news for you as parents is you don't need to know much about WAVE other than it's something that your child will be using a lot when they go to school here, including but not limited to when they're coming and going from campus. So in general, all boarders will depart for our 5 or 6 breaks during the course of the year, and boarders can leave at other times as well, as I mentioned. And as I mentioned, you don't need any training on how to use WAVE as a parent, even though your child will need some training that they'll get when they arrive to campus. But every single time your child wants to leave campus, we will not allow them to leave unless you, the parent, has consented to their plans. And the way you, the parent, can do that is just by checking your email. So if your child submits a leave request, their plans are to, depart for whatever reason, a medical appointment, a college visit, they will submit that plan on their app, and it will go straight to your email, and it'll look just like what you see on the screen here for you to approve or decline. An example that comes up, a decent amount is some families are more comfortable than others with their child using an Uber or a Lyft driver. If you see the plan for your child to go to a friend's house on the weekend and they're saying they want to go in an Uber and you're not comfortable with it, you can decline that request and the school will not approve. So the school waits for your child to approve any of their, for you to approve your child's leave request anytime they wish to depart. And we will follow your lead, knowing that every family is different and has different comfort levels as far as what their child is going to do. It's important to note that even if you do approve, the school does not approve every request to leave campus because of what's on the screen there. A really great part of the culture of this school is the massive majority of our students are on campus, in class, in their different commitments when they're supposed to be there. And that's what our faculty are planning. They're planning for all students to be present at all times. So the school takes that very seriously, which means that we don't approve every leave request for your child if they're going to be missing a lot of their classes or other school commitments. And if the reason is along the lines of maybe more personal or more of a family vacation, the school doesn't support those types of leave requests. So we ask if you have plans for your child to miss a week of school for a vacation, that you make adjustments to those plans now. I talked about open weekends a bit earlier. There are a few closed weekends during the year, including the very first two, I believe September 11th and 12th, and September 18th and 19th. On those weekends, the school is trying to build community very deliberately, such that we do not allow students to leave during those times or to go overnight during those times. And I understand that sometimes parents are still in the area because they've just dropped their kids off and they want to see their kids more. Those weekends are our opportunity, especially to help them adjust and to integrate, even though you, as their parents, are of course wanting to see them a lot. I mentioned before that the student is in the driver's seat, and even though they're in the driver's seat, they're definitely in Zach's slides always resonate with me, between the danger zone and between the comfort zone and learning to sort of stretch that comfort zone. A lot of your kids stretching their comfort zone is with you, sometimes as their parent, taking a step back and not being in the driver's seat anymore, even if that's what you're used to with your kids living at home. So a few pieces of advice on how you can help be a navigator, knowing that at this school, we're going to treat your child as the driver, is to make sure you follow our protocols. And that's almost always the student taking the lead. It doesn't mean that you, the parent, shouldn't be fully aware and be giving feedback, especially to your child throughout, but also understand that they're learning how to take control and take command of their lives. So it's not abnormal. In fact, it's pretty common probably that a Hill student might call home and tell you something is going terribly, that they're failing a class, that they're never going to talk to their roommate again, and that it's very likely that when the full picture is learned, that the situation is not nearly as dire as what they may lead to be the case. So I definitely encourage you as parents not to panic and to be patient, and really lean on the school, calling the advisor, calling the dean's office or the academic office if you're hearing something from your child that feels concerning. But your child is ultimately going to be the one that plays the biggest role in ameliorating or mitigating those challenges that arise. And they will arise with every single student. No student here has a fully smooth experience. And we actually want that for them. We want them to have some of those challenges and conundrums so that they can develop the skills of solving those problems as they arise. As we mentioned a few times, is absolutely contact the advisor first with any questions or concerns about anything. If your child is struggling in math class, please do not contact the math teacher directly. Start by contacting the advisor, and the advisor will work internally with the math teacher, with the dorm parent, with the offices to help the student navigate through whatever the challenge may be. I always like to tell parents at this time that the school will be extremely proactive in supporting your kids in all the different areas on the screen and many others. But another way of saying we'll be proactive is that we will hold all of our students accountable to all of these and support our students through all of these. They might be homesick early on, or there might be challenges with appropriate social media usage. We are used to working through these different types of challenges, and we'll be very proactive in identifying what's happening and how to best solve those challenges. Related to that is health is not just COVID-19. Obviously, we have a lot of measures in place last year and continuing on during the COVID-19 pandemic, but there are other forms of health that the school takes just as seriously, if not even more seriously, including everything that you see on the screen there. How students treat others, not just other students at the school, but other people in the world, even strangers, We care about that more than any other part of their development at the school. We care about it more than where they go to college. We care about it more than getting straight A's. We believe the most important thing for our students is how they treat others and how they treat themselves. And another way to say it is all human beings have worth and dignity, and we expect at this school that they'll be treated accordingly that way at all times. And we see that as the top priority for our students. Those things are all outlined pretty clearly in the handbook, and we work with students on those areas every minute of every day, so that 10 years from now and 20 years from now, when they're long done with college, that they feel good about their lives and feel good about the relationships in their lives, including, of course, with you, their parents. So just to quickly review as I finish up, who to contact: start almost always with the advisor. If for some reason you can't reach the advisor, you can always reach any of the people that Zack introduced at the beginning. The Wellness Center number, I know you saw some other phone numbers. You want to take a picture of this one. You can reach a live medical professional right here on the Hill campus every hour of every day that your child is on campus. So anytime that the school's open, including now, you can always reach somebody from the Wellness Center, no matter the hour of the day. I know we've got a lot of different time zones on the call here. You can always reach a live human being from our Wellness Center at that number. Zack also gave this number. This is another really valuable number. Even when there aren't students on this campus, this campus has security physically on the site every hour of every day of the year. You can always reach Hill Security with that number. You can reach the dean's office, the different people in it. You've got the number at the bottom. You've got dean's office at thehill.org, which gives you all those people, but you've also got different email addresses there. You can feel free to take a picture of that. And just to wrap up, I'll just say it's not easy, but it's a lot easier if we're partners in everything that we do. And I commit to you, we all commit to you on this call, that we'll do anything we possibly can to support all of you to make sure that your kids are not socially distanced, so that they're getting the support that they need and that you are getting the support that you need. A lot of people ask what whatsoever things are true the school's motto means. To me, that is what it means, which is that we'll do anything to support each other with anything that comes up any hour of any day. You can obviously have your own way to interpret that passage, but that is a commitment that we're very comfortable making to all of you on this call now. So we thank you all for joining. I know the medical presentation's coming on right now, so I'm going to unshare. And I definitely look forward to meeting a lot of you in person if that's possible this year, but I'm sure we'll all be able to have chances to communicate even if you can't physically get to campus. So I'm going to turn it over to my colleagues, Dr. Spencer and Ms. Rothling, who work with our medical and wellness programming. So Dr. Spencer, you're up.
Thank you, Ari. Ari, are you able to see my slides now?
We
Yeah,
are.
looks good.
Okay, thank you. Okay, I'm Kristin Spencer, Medical Director and Physician at the Hill School, and I am privileged to welcome you to Hill. We are so excited to welcome your students in just a short while. I refer to the health and wellness team as the team behind the team. Your students are coming to Hill to thrive in the classroom, on the field, on the stage, in the dormitory, in their activities and their social connections with their peers. And the health and wellness team is here to support them in any way we can to help them be the healthiest, safest, and best version of themselves in that undertaking. Healthcare at the Hill School consists of 3 clinics. We have the Wellness Center, which is the classic medical or health center with nursing support and provider support. We have the Counseling Center and then athletic training program as well. And this year we are all connected via our electronic health record to be able to partner and share more information in real time when appropriate, with appropriate boundaries, but in order to collaborate more closely. Health and Wellness at Hill partners with a lot of different departments to surround your students' primary objective of excelling in academics and athletics. Couple of examples, we have a lot of students with food allergies and EpiPens. We work closely with the dining hall to identify those students who need special plates to avoid those allergens. We also communicate that information to advisors and coaches and dorm parents so that when they bring food or schedule food to be part of an event, there's no concern that a student is going to come across an allergen that is unsuspected. We work closely with residential life for accommodations in the dormitory. Our diabetics have refrigerators in their rooms, for example, to keep their life-saving insulin. So those are just a couple of examples of the many ways that we all work together on campus to support your students. The Wellness Center is comprised of and staffed by a number of talented nurses and administrative assistant, and the director of wellness, Kathy Van Buren, my colleague who is a nurse practitioner with her doctorate in nursing practice. These nurses are phenomenal. They are not only providing the care that your students need, but they are warm and friendly, and sometimes a hug is really what the student needs. And their smiles and welcoming demeanor really goes a long way to making your students at ease during a potentially tough day. So the Wellness Center is open 24 hours a day, 7 days a week when students are on campus. There is always a nurse on duty. There's always a provider, either Kathy or myself, on duty after hours for consultation and to come in when needed. We do a lot of medication management. Students who require daily medications, some of those need to be administered from the Wellness Center, and students will come in the morning before first period to get their daily dose of medication. The nurse is overseeing that and also helps parents facilitate prescription refills and dose changes and things like that during the school year. We have observation beds. Those are used for overnight and also during the day when maybe a prolonged stay is needed. Maybe a student is not feeling well and needs to rest for an hour or two before getting back into their full Hill commitments. We provide a lot of support for chronic medical needs. So we have diabetics and students with inflammatory bowel disease, asthma, seizure disorder, any number of chronic medical conditions. We partner with the specialist or the primary care physician to best support the student on campus. In addition to that, we operate essentially as an urgent care for walk-in acute illness or injury with some suturing of minor wounds. We splint injuries, sprains, strains, fractures. A lot of that actually begins with the athletic trainers, but we partner closely with them. We provide point of care testing that predates long before the pandemic to include a number of tests: strep, mono, flu, urine tests. We do about 9 tests on campus. So we see these students for their acute illness or injury, but we also make referrals when appropriate to the emergency department for more serious injury or illness, also for some routine laboratory studies, imaging when necessary, and specialist visits off campus. My colleague, Dr. Van Buren, has quite a lengthy resume in treating concussions and is instrumental in how we diagnose, follow, and refer out concussion patients over the course of the year. We work closely together on that. We also partner with the academic office when accommodations are necessary for healing. It wouldn't be a talk in today's age without some mention of COVID. I want to just emphasize that our high vaccination rate is really what allows us to undertake a year in the way that we are planning to return to near normal. We've learned a lot of good lessons over the last year, some that we'll definitely keep. We're all, I think, more diligent and cognizant of the need for careful hand washing, of paying attention when we're sick, of masking when necessary, and the testing, of course, plays an integral role of diagnosing cases early and taking the appropriate measures. So our goal this year is to do less of the distancing and more of the return to a near normal year to the extent that we're necessary. Now, I do want to mention that yesterday the state of Pennsylvania has issued a mask order that goes into effect on September 7th for schools. We are currently talking with our public health officials on what that means for a community like Hill that is different from the typical public school with our very high vaccination rates. So despite all these things with the chronic illness, acute injury, COVID, all these things that we have to consider, I always want our students to be reminded to get back to the basics, that good hydration, exercise, sleep, nutrition, personal hygiene, social interactions, all these healthy parts of a student will really promote thriving here at Hill, and we try to educate and promote that type of lifestyle. Wellness Center staff at thehill.org is a way to reach us. You can also use the secure messaging in the patient portal and the phone number again for any contact you need to make with the Wellness Center. So I always want to focus on prevention. That's for illness, that's for injury, and then we treat what we can't prevent. So with that, I will turn it over to my colleague.
All right, well, welcome everybody. My name is Lisa Rothling. I'm the Director of Counseling here, and I just wanted to say welcome, and it's just so great to see students back on campus. So today I'm going to be talking to you about our clinical services here at Hill, and I'm always so proud when I see this slide because Hill School, in my opinion, does a fantastic job of really creating a space for mental health in a meaningful way. So for a school this size, we have 5 licensed clinicians, and the clinical services that we provide here are part of the boarding tuition, which is really incredible. In addition to our clinical staff, we have a prevention education specialist who really plugs in with the students in our eudaimonia program, which I'll talk about here in a little bit. So as far as my team goes, we have clinicians who have specialties in different areas of counseling, which is really great. So we're really well equipped to deal with many different kinds of issues that students might have regarding their mental health while here at Hill. And as I said, all of our clinicians are licensed or working under my supervision for licensure. And so this is a really great way to get clinical services while your student is attending. We are located in the opposite end of the Wellness Center, which is very convenient. So where the arrow is pointing is where the counseling center is. We have our own separate entrance, which is really nice. We really our goal is to operate our counseling clinic much like a mental health clinic in the community. So I'll talk a little bit more about how we do that, but essentially, we reserve the right for confidentiality, we sign appropriate paperwork, and even though we share an electronic health record with the medical center, or I'm sorry, the wellness center, they're not able to view our clinical notes or our counseling notes. So only the information that's shared back and forth is around medication, and that's it. The best way for students to access our services are just to walk in Monday through Friday, 8:30 to 4:30. We have an on-call counselor available to talk with any student. And then on nights and weekends, we have somebody on call. So 24 hours a day when students are on campus, we do have an on-call clinician. If they want to set up a scheduled appointment, they can do that as well. And a parent can also contact our counseling center at counseling@thehill.org. That is the best way to get in contact with a clinician. And within 24 hours, somebody will be in touch with the student or you as a parent. And this is just a confidential email that comes just to the counseling team. As far as our process is concerned, there's lots of different reasons why students would come into counseling. So we really take our time to assess the situation. So the first time we meet with a student, it's really just a screening session. We're really getting information, really kind of seeing what the student needs. If the student needs and wants clinical counseling, which is typically about 10 to 12 sessions, we will sign what's called an informed consent, which is a document that it educates the client about what their rights are in counseling. And most importantly, we talk with them about confidentiality. This document is on our website for you as parents, and I believe you also signed it as part of your onboarding documents for the Wellness Center. We do and are mandated reporters like other adults on this campus, but under our licensure, there are times we do have to report both to parents or even to authorities if there's abuse, if there is any reported issues of safety, which we can go into in a little bit. But essentially, we really want this to be a place where students can process stress and anxiety if they're having any depressive symptoms, issues with roommates, homesickness. We want them to have a safe place where they can come and talk. In the state of Pennsylvania, PA Act 147 does allow licensed providers to see students without parental permission. We are a family systems based model, which means that we're always going to encourage kids to inform their parents and even bring their parents into counseling sessions if necessary. So we do have a licensed marriage and family therapist on our team, which is really great. But we'll do our best to bring parents in when appropriate. And sometimes, students aren't ready for that. So we'll work with the student to do that in the timing that makes the best sense for their mental health. We use a really neat clinical tool. I just shared this slide because it's pretty unique to counseling centers, especially in the school setting. And really what this tool allows us to do is it allows us as clinicians to see if the student is getting better based on the counseling we're providing. So there's a lot of evidence and research behind this tool. If by session 6 we're not seeing a lot of progress, it's a really good indicator for possible further referral. Maybe it's a referral for a specialty of some sort outside of what we can provide. It just really helps us track the counseling process and also work with parents on, the best overall picture for the student's well-being. We have 2 psychiatry consultants that we work with. They are not contracted with Hill School, but we will work with them and parents. These 2 folks definitely understand the boarding school setting, and I think especially when you're seeking psychiatry support, you really want somebody who understands the nuances of international students being here and also understanding the nuances of a boarding school. So we've worked with them in the past and have had really great experiences, both students and families. So if you are needing any kind of consultation for medication management or even just a further assessment, we do work with these 2 doctors, and I can provide more information if you're ever interested in that route. In regards to mental health medical leave, Dr. Spencer and I really work closely with our medical leave committee to determine what is a medical leave based on mental health. So we have a lot of students who are in distress or who may even be depressed or anxious. And we have, I feel, a very rigorous screening process and clinical tools that help us determine a level of safety. So things that students might be put on medical leave for basically is anything regarding a mental health condition that's interfering with their daily life. They cannot maybe function in the setting of a boarding student. They're not able to go to class, or their grades are dropping, or maybe there's some safety issues. We have a lot of expertise in how to measure these, the severity of the conditions. And so when we do a mental health medical leave, it's usually, I'll just say it's almost always because a student needs mental health support outside of what we can provide here at Hill. And we've been really fortunate in the last 2 years. Every student we put on medical leave has returned successfully and flourished, in their community once they returned. So the process can feel, I think at times, maybe a little surprising, but we involve the parents from the very beginning, and we really communicate what's needed. And the goal always is for the health of the student, the mental health and the physical health of the student, most importantly for the student to return and be successful here at Hill School. Doug Jones, who I mentioned earlier, he's an incredible asset to our team. He teaches our Eudaimonia and Health Plus classes, and these classes were really redesigned last year. We piloted this program in a different way. Mr. Jones has a master's degree in positive psychology, and our focus is different for each form based on science and the brain development and what's going on developmentally for students at different ages. So for the third form students, we're really focusing on executive functioning, all the things that third formers need: organization and coping skills, and getting through stressful periods of living with a new person, and all of those adjustment pieces. And then in the fourth and the fifth form, we're teaching students about mental health, sexual health, and drug and alcohol prevention. This was very, very widely received by students very well last year, and we did some monitoring and measuring of the classes when we had them. And so the entire curriculum is posted online in our website if you want to take a closer look at that, but certainly was a great hit with the students, and I think they were really thankful for the information they were getting. And then in our sixth form class, we are focusing on well-being beyond Hill. So this is really about the transition to college. We did a lot of really fun and unique things last year by bringing in some Hill alumni who were out of high school for maybe a year or two to really talk about what that transition is like, because it can be quite a transition coming from the bubble of Hill to a big university with less eyes on a student. So that was a really fun class for us to teach. We've created a Teen Talk parent workshop series that this will be happening throughout the year. I highly, highly recommend if there's a topic that interests you or just something you want to know more about to attend. We have experts from our own team as well as some outside providers that are really going to tackle some concerns or issues that we saw here on campus over the last 2 years. All of these workshops are via Zoom from 7 to 8:15 at night. And the first one coming up is on September 23rd. September is Suicide Awareness Month. So we'll be doing education with all the faculty and all the students on just really understanding signs of suicide and what's the difference between sadness and depression. This workshop in particular I'll be doing, and it's really recognizing the signs in your teen. Are they okay? How do I have that conversation? It's really a skill-based training I'm hoping that you'll find beneficial. I've created a well-being page for parents as well. And this page, there's a slide at the end, and I can send this information out. It's connected to our website, and this is a page for parents that really gives you all the information in real time. So our goal is when we're teaching students about well-being topics, we want parents to have the same information in real time so that conversation can be married a little bit better. So when we're talking in Eudaimonia about healthy choices around substances, there's going to be parent information and options and workshops or all kinds of resources for you as a parent to bolster your skill set in having those conversations in real time with students. This is also where all of our information will be advertised regarding workshops for parents. There's some really great information on there around other areas of support that you might need. I know video gaming right now is a big deal, and video game addiction has definitely been in the highlight of mental health work in the last 5 to 7 years. And there's a lot of really great new resources that have come out around video game addiction that I put on this page that can be helpful for you as a parent just to look through. But there's lots of things on there. I encourage you to visit it as often as you need. One of the other pieces we're offering this last year and into the next couple of years is we have a parent course on the impact of THC in the brain and academics specifically. So we've partnered with this company called Panaptic, and they have created a product called Impact, which has been pretty awesome. And it's an hour-and-a-half online course for parents, and it really is engaging, and it gives parents the language to talk to their kids about marijuana use. As we know, the use has changed, the THC contents have changed. So it really brings you into the now with the right information. Even if your students aren't using substances, which we hope they're not, their friends likely will be. So as a parent, it gives you the right information and language. And this stuff is changing every day. I'm a licensed addictions therapist, and I'm telling you, I have to read up literally weekly on the trends and what we know. And there's just lots of great information in this course. If you're interested, all of the information is on the well-being page. It's free, and you can start and stop at any time, which is really great. Here are some of those resources I talked about. You can access all of these through the well-being page that I mentioned, which is on our Hill website. And also, if you have any questions at all ever, you're concerned about your kiddo, please email me directly or email counseling at the Hill. We do a lot of consultation with parents just about, it's really hard to have your student away from you during such a critical time of adolescence. So if you have questions, you're concerned, please call. And if it's not me, one of our clinicians can talk you through next steps or just have a conversation with you that might be helpful around anything your team might be going through.
Okay, I want to talk just briefly about the athletic training team. We have 3 talented athletic trainers. Steph Sheldonat is our head athletic trainer. She is out on maternity leave for the fall term. So Chris McGuigan has stepped into that role, and we have additional athletic training support from Jess Leiden, who has joined us this fall. The athletic training services are really important in terms of preventing injury for our athletes, for helping with conditions on the field of when it's safe to play, when we need to scale back due to heat or weather. They also are instrumental in providing that first response to an injury on the field. So they will assess that student right at the sideline or even on the field, determine the level of care that is needed and the appropriate follow-up. Sometimes that's to the wellness center. Sometimes it's a phone call to me. Sometimes it's a 911 call to the hospital. That's rare, but it happens occasionally. So they are instrumental in really overseeing the safety and the health of our students while they're on the field. They also do additional work with our athletes in terms of equipment, fitting, and condition of the equipment. We staff football games, for example, with an ambulance and an orthopedic surgeon on the sideline. So there are a lot of additional supports that we put in place for depending on the level of contact and risk for the sport, and really tailor that approach to each sport as needed. So you can see the contact information at the bottom of the slide there. If you have any questions specific to sport, that will be handled by the athletic training team, and they'd be happy to give you more information. So welcome to a great school year, and I will stop share at this point and see if there were any additional questions.
Well, thank you to all of my colleagues here who have done a great job presenting. And thanks to everyone for staying on. We've had everyone's been wrapped with attention. So, but this would be time for any questions, and you can either type them into the Q&A or raise your hand, and we're happy to take a few questions at this point. So I'll give that a minute. Okay, we have a question from Junlang Fang. Hello.
Hi.
Hi, how are you?
Yes, I'm good. Can you hear me?
I can, yes.
Yeah, I'm in Beijing. I'm Chelsea's mom.
Nice to see you. We saw Chelsea arrive last night.
Yes. Thank you for taking care of her and the warm welcome. My first question is about the COVID-19 vaccination. She got her vaccination in China. I just wonder if it's possible or recommended for her to get another shot of the FDA approved vaccination.
Kristin?
At this time, there is no recommendation to get additional vaccination. We are working closely with the public health officials here in Montgomery County, and they're following the science and CDC recommendations. I think there's going to be more information coming in the next few weeks or months from the CDC based on the large number of international students we have in boarding schools and colleges. So at this time, there's not a recommendation, but I would not be surprised if there isn't something coming down the pike in a couple of months.
Thank you. My second question is, given we're still in pandemic, is there any policy change concerning the open weekends since they're allowed to leave campus?
As of right now, we are not changing our leave policy. We're keeping a close eye on that, and we're certainly the dean's office will be reviewing all leave requests and that sort of thing. We're most concerned about our students who are unvaccinated leaving campus and returning to campus, and those students will likely have a quiet period upon returning an extra testing regimen. But as of right now, we're pretty cautiously optimistic about the strength of our vaccination on campus, and also the caution that we are hopeful that our students will take when off campus. And also, of course, the masking requirement by the state helps us build confidence as well.
And I'll just add to that, Zach, that even on open weekends, we don't actually have that many students most of the time leave. It's even in a normal year, it's not very common. Students prefer to stay on campus. So there's less on and off activity than one might envision, even though there are students who live close by.
Thank you.
Thank you. Yep.
I'm really thankful for all the information I learned today. So is this session, I'm seeing this session is being recorded.
Yep.
So wonder if all the information will be later on available somewhere on the Hill website?
Yes, we'll put it on our parent website or parent page, as well as we'll probably post it to our YouTube site and also to WeChat.
Thank you so much.
Yep. Take care. We'll take good care of
Care.
Chelsea. Bye-bye.
Thank you. Bye-bye.
All right. Well, I'm not seeing any other questions, but I'll wait a second to see if anyone raises their hand. All right. Well, I guess we did a great job of explaining everything. I'm sure there will be questions down the line. The best part of today is that you met the people that can answer your questions. And I hope you realize how helpful our team can be. Again, please don't hesitate to reach out at any time. If you have questions, you can come to any of us or any of our colleagues. And, we'll certainly, if we're not the right person, we'll direct you to the one who is. So thank you very much. We look forward to welcoming or re-welcoming all of our students to campus, and hopefully some of you as well in the coming days, weeks, and months. Have a great day, and go Hill. Take care.